Alright, first, you wash your hands. Water needs to be hot. Okay, as hot as you can handle it. Some fucking soap. Got my little setup here. I got, a piece of paper down. Got my shit in there. Paper towel, dry my hands. Alright, I just washed my hands and dried them off, right? But, give you a little fucking... You want to wash them like you're preparing for surgery. You know what I mean? Scrub them motherfuckers, sing the ABCs and all that shit, right? Fucking wash the shit out of your hands. You're going in for surgery. Alright, here's my fucking box here. It comes in, and I got it fucking double, triple fucking bagged and all that shit. I want to try to keep it as clean as possible, everything. You know what I mean? Alright, here's my setup. My blood sugar's a little low, so this camera might shake a little bit. But, because I haven't eaten yet. But, I got 4 pads. Got that ready to roll. And then my fresh pen. I will check the pen, take the cap off and look, don't breathe on it. I'm not trying to breathe on it, okay? But just want to look real close at the end. Make sure there's no anything obstructing the little hole at the end, making sure there's nothing wrong with the pen itself, you know what I mean, before I stick it in there, alright? Alrighty. Take one. First thing you do is you want to get a fresh alcohol pad. This morning might be a bad one. You know what I mean, right? See the little, and the most important part is the gray part, okay? Make sure you get that, and I know we got the alcohol on it, and that's disinfecting, but I'm also applying a little grit to it, you know what I mean? Applying a little pressure, and then I circles widen out and I go all the way around. Sometimes I'll do the whole fucking vial. Every once in a while, I'll fucking swab everything, the whole fucking thing. Fuck it, right? And you want to give that time to dry, right? So that's why you do this one first. Boom. And then throw this one away. That's it for that one, okay? Now, I've already checked my records, and I know last week I did lower left, so now, or a couple days ago, 3 days ago, now I'm going to do lower right. So I'll grab my other pad, and what I do is I'm going to get down into my position that I was going to inject with, right? And I apply this first to give it time to dry, because I don't want to inject myself if my skin is still wet with alcohol, because it's going to sting and burn and all that, okay? Alright, so my plan is to come here in this right quadrant, and look at that, boom, that was a perfect fucking first squeeze. So, very light, you know what I mean? Look, I got a big old fucking, so I pinch more than an inch, like I said. And I don't, doing circles and come outward, get the whole fucking quadrant. Because, what are the chances that I'm going to hit exactly where I fucking swab, So, boom, there's one. And since I'm hairy, I haven't shaved in a while, I go and I hit a second one just to make sure it's good and disinfected. You got all kinds of bacteria on your skin. We all do, all the time. So, same thing. I don't really need to pinch it this time. And I go start where I think I'm going to want to pin, and then move outwards. Get the whole quadrant, right? Cover everything, and apply a little grit, scrub it, scrub it, scrub it, scrub it, scrub it, scrub it, scrub it. Now, between the vial and my skin, by the time I get the needle filled, those two would have dried by then. Okay, here we go. I pull the bottom off first, then the top. You don't want to breathe on it. Now look, this one is fucking pretty crooked, and I don't like that. Sometimes it comes at an angle, and I don't really like that, but I might pick a different one. Now, you don't have to, you know what I mean, as long as, but since I'm a little more shaky this morning because my nerves got me on camera and shit, that's probably what it is. But not a big deal. I got plenty of fucking rigs. or pins. Rig is what the drug addicts terminology what they use. So put this one to the side. Make sure you don't fucking mistake shit. Now let's try this one. Okay, bottom off first. Top up. Boom, straight. And during this time, I'm trying to breathe through my nose mostly because I don't want to breathe my mouth on it. Now, first thing I do is there's always a little space there. Push it up all the way. Then pull all the way back, and I go about 0.5 milliliters. All right, 0.5 milliliters past what my dose is going to be. So I'm doing 0.35, so I go to 0.40. All right. Alright, okay, I'm stuck in, and I'm injecting it with air. That way, the oil comes out easier. Sometimes it'll try to press up by itself again, but just push it down. Alright, it's pressed down, I turn it upside down, having it face me. Alright, I'm looking at the oil, having it face me, and I go, not completely up and down, but at a 45-degree angle about. Pull back nice and slow. There's a bubble in there. What I found is that if you don't stop and you have a consistent pulling, it'll just stay in that one bubble. But you want to go nice and slow, because if you try to pull hard, it's going to put all kinds of bubbles in it and stuff. You want to just keep that bubble the only one you got to deal with. So I pull back and go beyond where my dose is, and then push back in and try to get that bubble out by pushing it back into the bottle, the air. Okay, so here I go, pulling. Got one perfect little bubble there. Pulling. I'm just now hitting 0.35. Passing 0.35 on my way to 0.40, which is how much air I put in. Alright, now I'm going to try to come up more and push in at the same time, and that bubble will suck right in perfect, and then measure it off. Continue pressing in until you reach, I go slightly above my dose, because some oil probably gets trapped in the needle at the end. So I do it just a slightly above a fucking cunt hair. Pull out. Okay, flip it back down and pull out. And now you check it for bubbles. Alright, check it for bubbles. Boom, this one's perfect. Perfect. No residual bubbles or nothing. I don't know if you can really see. No residual bubbles. Now the big one at the top, something like that, you have to get out, okay? Or else that will cause shit like that. But if there's little tiny ones that are just fucking, you're trying forever and you're flicking it and you're doing, you can even pull back, put more air in, then flick it, and then try to, get all the bubbles and consolidate it into one bubble, then push that out. And you can do that too, but you do risk a little drop of oil coming out on the pin, and when that happens, I'll flick it some more, get that oil off before I inject. But the harder you flick it, the more you flick it, it might put even more bubbles in there. So you got, you gotta kind of fuck with it. In this case, perfect. So for demonstration purposes, this one worked out good. Okay, and now I just gotta worry about fucking pinning and not being all shaky and stuff. All right, give me a sec. And I gotta pee. So if you look at the tip, there's a little, you can see the bevel or whatever it's called. Okay, there's a little, and I make sure that that's facing outward toward my skin instead of downward toward my intestines and stuff. Right, so I want that pointed up. Right, you for sure can't see it, I'm sure, but the hole is facing toward my skin, toward the outer layer. Right? So coming straight out. And
I go, get a nice big grab of that area in that quadrant. Alright? Okay. Get her here. You still see? Okay. And I want to go right into the meat of that fucking bubble, right? At a 45-degree angle. Not straight in. 45-degree angle to where it's going to be all up in that fucking bunch, right? But at the same time, I don't want to increase the pressure in there, fucking with the oil, so I have a big grip. That way I got plenty of fucking room. Pressure's on because the camera. Up. Hammer. Nice and slow. Try not to breathe in your stomach. Alright, there's a bubble, cocksucker. It's alright though, it's a tiny one. This one's going good. Except for my shaking. I'm losing grip on the fucking needle at the same time. Son of a bitch. Okay. Try not to be shaking so much like I am. Sometimes this happens with the coffee and everything. I haven't eaten yet. So I'm shaking. I think it's because my blood sugar's low. Okay. So I'm all the way pressed. Let go. And I press a little bit harder and I count 1,000. Make sure it's all out. Slide out, the same angle. Sometimes a little drop of blood might come out, but boom, nice. Check, boom, looks like I got it all out. Got a little tiny, here we go. A little tiny blood spot here, but that's fucking common, okay? That's nothing. I've seen way worse if I hit, and I probably could have predicted that, because right as I was pressing in, I felt a little more, stinging. Sometimes it'll go in like butter, and I don't feel nothing. And other times, as I'm going in, I'll feel a little sting. And what that means usually is that I nicked a blood vessel on my way in, which happens. Like other times, I won't even feel it, and I'll go right in, and everything will be fine. Other times I'll be pressing, and I'll feel some stinging as I'm pressing. Typically, in when I do the areas like that have less fat, less thickness of fat, is when I feel that. So I feel like, so around the lower part of my abdomen, closer to my belly button, the lower is, the only time I feel that pain is when I'm doing in the upper quadrant, more to the left, where there's less fat. That's the only time that I feel any kind of stinging, when, as I'm pressing the oil. I think one time I had, where it was like, I had to stop for a second because it hurt, but that could just be from not doing it in that spot before, or it could be a completely virgin spot, or fucking fat's thinner, or maybe I nicked a blood vessel or something. But typically, on one like that, I didn't have no blood come out. So But you'll start to learn when you get more successful injections. You'll start to learn, okay, this is an easy place. This is an easy place. You know, and you'll get it down. You know what I mean? So now I'm gonna fucking top back on there first. Think, bottom, think, and put my fucking oil back in the box. Oil in there. And the little fucking cap I keep with the metal side down as if it was brand new. And put it away, put it back in the bag. Now I'm gonna go in there, take a picture, and date it and save it into my file, my folder on my phone. So that way I can look, if I forget, I can go back and look and be like, okay, boom, last 2-3 times, okay. So I know exactly what I hit last time and what I need to hit this time. So I'm gonna go do that real quick. I'll be back. Right, side note I'm throwing in here, when you're pressing, you know, at the end when I said to press it down, make sure it's all out while you're counting, you want to make sure that you're not pressing the needle into your body hard, okay? You don't want to press into your body hard at all. You want to be as gentle as possible. What I'm doing is I'm holding the needle in position with my one hand and then pressing hard the fucking hammer down on it hard to, you know, to fucking get it all out. But by no means is that pressure being applied to my body. Okay, you want to fucking as gentle as possible, get that needle in there, try not to move it around at all. You know, you want to get in, get out, and, you know, do the least amount of damage as possible. Just wanted to make sure I fucking put that in there. Alright, back for my last alcohol swab I had left out. Boom. You know exactly where it's at because of the little blood spot. And this alcohol pad, we'll fucking take that right off. Boom. Alright, because in case I got any fucking germs on my hands or anything like that, it's going to take care of that. Alright, and then I just kind of suck in a little bit. Do little drums. 1. In this case, this one doesn't even hurt as I'm patting it. So, good pin. There's no post-injection pain. Boom, you're all set. And then you hit the fucking flex. Lats in check, chest in check, shoulders, just trimmed shoulders yesterday. And you fucking just suck your dick a little bit, suck your own cock in the mirror, and then you're good for the day.